It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Welcome to the Sam Lesante Show, folks. Well, they won a People's Choice Award, and it's just amazing how the Lehigh Valley Health Network is doing here in the greater Hazleton area and also throughout northeastern and central Pennsylvania. Today, we're going to learn about a new surgeon, not new surgery, but Dr. Joshua Nochumson is here on the Sam Lesante Show. Now, interesting, folks, we're going to learn a little bit about what he does, but there's some interesting things in this show that you're going to really want to know about. Doctor, thanks for coming on the show.
Well, thank you for having me. It's a pleasure to be here.
It's a pleasure to have you, and welcome to the greater Hazleton area.
Thank you.
So tell me about, it's Nochumson, right?
That's correct.
Okay.
Yeah,
now, tell me about yourself.
Well,
One question before you interrupt. Why did you decide to become a doctor?
Well, that's it's an easy and a hard question to answer, but ultimately I decided when I was in high school. I had a lot of different interests, and my junior year in high school I took a course in genetics and embryology, and that just floored me with the just the beauty and the elegance of science and at the molecular level with genes and cells, and the idea that we could, correct disease in our body by altering the genetics and the molecular biology, to me was just fascinating and very elegant. So that kind of pushed me in the direction of a science background and likely a medical background going forward. Now, I didn't expect it would take me into the direction of surgery, but it got me in the door in medicine, and my path went in ways that I didn't imagine initially, but I'm glad to be where I'm at.
So you graduated from college?
I graduated from college, and I went to medical school thinking at the time that I was going to go into maybe academic medicine, do a lot of research maybe with at the molecular and genetic level with maybe cancer research, and I was going to be a big shot research clinician maybe in a major metropolitan area. And I was on track to do this, and as you move forward in life, you get exposure to different opportunities and things you hadn't, been expecting to be of interest to you. And that happened to me. My third year in medical school, I felt like this is the year that you go through a variety of clinical rotations. Go through pediatrics, family practice, OB-GYN, and surgery and medicine. So I felt like I was geared towards a medical background in maybe a hematology, oncology field, something along those lines. My last rotation of my third year was surgery, and everyone usually dreads the surgery rotation because it's very it's demanding. You have to be up at the hospital very early in the morning. You don't get home till very late. You don't always get treated very well. And so my goal at that point was just to muddle through it and get through it so I could move on with my research career. But as I was going through that rotation, something transformed in me. I realized, gosh, I really like this. I mean, it's really the idea that you get instant gratification, you get to work with your hands, you get to be involved in people at very vulnerable points in their life, and to come in and shepherd them through these challenging moments for them, to me was really an eye-opening thing. And those were some of the skills that I didn't realize that I possessed, but at some point I had to make that decision. You know what? I really do like this, and my whole life kind of changed at that moment. I would have had a totally different career in life had I gone down that research pathway instead of becoming a surgeon. But surgery has been wonderful. I'm still in awe of the skill set that the training provides you, and it's been wonderful.
The reason I asked those questions is because, in life, if you have a passion for something, okay, you just go and do it, and it explodes, and that's why you have that passion, and that's why you're doing as well as you're doing, which I think that's important, to have the burning desire. Sometimes people have. Are there any doctors in your family?
In my very extended family, yes, but I didn't have any regular contact.
So you didn't have your parents saying, "I want you to be a doctor," like I want you to be a lawyer, I want you to be a doctor, etc. You just developed that in high school and decided that you were going to go in that direction.
Yeah, I suppose it was always an option. I knew that the field of medicine was a very exciting field to be in. They were constantly, if you liked to learn and develop new skills, it was always an option for me. But I was not a savant in any particular field. I liked a lot of different things, and so to finally have to make a decision was tough. But I felt, I guess in the end, if I had an opportunity to become a doctor at the time and didn't take advantage of it, maybe I would regret it.
So where'd you start off with?
So I was in college in the South. I grew up in the Northeast, spending time in Maine when I was really young, and in high school I was in New Jersey. And my senior year in high school, my family ended up moving to Texas, which was quite a culture shock for us.
I would think.
And again, it was
What
one
part
of
of
these.
Texas?
Initially, it was in Houston.
Oh,
and so,
nice area.
right. So if you're not from that part of the country, you realize this country is very diverse, and different parts of it are completely different from each other. And Texas was quite a culture shock. But that winter, being exposed to weather that was in the 70s, as opposed to my friends who were up here, with the cold rain and snow, it encouraged me to stay down in that area for my college experience. And so I ended up going to college in the South. And then ultimately I did my medical training in Dallas before coming back up to the Northeast. I always figured I would come back to the Northeast just because I grew up here.
Did you
and I had
practice in
family
Texas?
here. I didn't. I just did. Once I finished my surgical fellowship, I came back to New Jersey.
Where were you practicing in New Jersey?
I was in a small town called Pompton Plains, which is near a larger town, Wayne, which is in north central New Jersey. So it was at a small community hospital, kind of a satellite hospital of a larger health system, similar to Lehigh Valley Hazleton, which is more of a community hospital in the setting of a bigger health system.
So you're married?
I'm married. I have a beautiful wife and two beautiful, lovely daughters who are 1 and 3.
Oh, that's fantastic. So what was your very first surgery?
My very first surgery in training was actually, I had scrubbed in to help insert a feeding tube in the stomach, someone who could not, had an esophageal tumor and could not swallow easily, so we put a feeding tube in him.
You practiced in New Jersey, right?
That's correct.
So now you make the move up here with Lehigh Valley. So what was the reason why you decided to leave there and come up to the Lehigh Valley Health Network?
Well, it was not an easy decision. I was in practice in New Jersey since 2009, and I enjoyed being where I was. But at sometimes the timing is just right for a change. And in New Jersey, as much as I liked it, there's a pace of life issue that maybe was not what I was hoping for or looking for. And my situation's unique because going from New Jersey to Texas, there was a big culture shift, and the people in Texas who I met were very friendly to me. I really enjoyed being in that area and taking care of those patients. When I came to New Jersey, again, the pace of life is a little bit more intense. It's a little bit more congested there, and I just felt like I would be better off in a place that was maybe a little bit more laid back, low key, where the people are just very friendly, and the community had a need to have maybe some new blood in here and offer a variety of services that may not have been available previously to the community. And so we were looking, and this opportunity came up that had, requested someone who had both a general surgery background and maybe a subspecialized focus in colon and rectal surgery, which is what I did my fellowship in. And after visiting here for the first time in January in the midst of a very cold, damp and gray day, I made a decision that this was where I wanted to be, because the people that I met here were very passionate about this community, very friendly, very easy to get along with.
And now you found the Lehigh Valley Hospital to meet your expectations as to what you wanted to accomplish.
Well, I think I'm hopeful that the skills that I bring to the table here will be valuable and useful to the community, and the goal is to enhance the care of this community, to make Lehigh Valley Hospital and the hospital and the services here better for the people that are going to be utilizing them. So that's the hope. And again, Lehigh Valley is putting a lot of resources into the hospital, bringing in new providers, new technology, and so it was an exciting time to come on board and maybe be a part of that process of becoming.
Folks, you're listening to Dr. Josh Nochumson, not new to surgery, but new to the Hazleton area with Lehigh Valley Health Network. We come back, we'll talk about what does he bring to the table? What are some of the new technologies that are here? As you know, it's just amazing what our healthcare is in this area. Throughout northeastern and central Pennsylvania, it's phenomenal. Stay with us. Welcome back to the Sam Lesante Show, folks. Remember, 24/7, you can watch all of our programming on ssptv.com. And if you did not download our app, do so now. Search SSP TV. All the shows we produce, particularly this show, healthcare shows, learn a lot. Speaking of learn a lot, we have Dr. Josh Nochumson here. Not new to surgery, but new to the greater Hazleton area. You're located at the Health and Wellness Center, correct?
That's correct.
Yeah. And folks, the number is very easy, 570-501-4LBH. That's 570-501-4LBH. So, doctor, you were talking about, you were excited about when you got in high school, the science and medicine, you're excited about what you do. So now, you're working up at the Health and Wellness Center with a team, right? Who's on the team with you?
So right now in the office with me are two other surgeons. I believe they've both been on this show before. One is Dr. Mahoney, yes, and Dr. Walco. Yeah. And the practice that I'm joining is being managed by a surgeon, a trauma surgeon from Cedar Crest in Allentown, Dr. Lieberman. Yes. And so they're a great group of guys, very committed to the practice of good surgery and to the community. So I'm very fortunate to join this practice.
How did you find that? Because I find that exciting. I mean, people say, well, you get a second opinion. Well, in some cases, now with the network, you get second, third, fourth, fifth, sixth opinions because, you all work together. If there's areas that, you really want to concentrate on. I mean, did you find that to be, I think that's fabulous for any patient, knowing that they're in that kind of care.
Well, sure. I think patients want to feel comfortable with their physicians and with the information that they're getting from their physicians. And when there's a need for more input about their particular illness or disease process, it's sometimes very helpful to have multiple people give their thoughts. And as physicians, we often like to get the input from other physicians, especially in cases that are not always very straightforward. So to have a group of people who are very well trained and capable, as your colleagues in this area here, it's very encouraging and it's helpful.
What will be some of the surgeries that you'll be performing as a general surgeon?
Well, a general surgeon can do a wide variety of surgery. In fact, I mean, they can span the gamut from head and neck procedures, thyroid procedures, breast surgeries, abdominal procedures, even some types of vascular procedures. For me, I mean, I had trained as a general surgeon, and then I did an extra year of fellowship to subspecialize in colon and rectal surgery. So over the last 8 or 9 years, I've primarily done mostly colon and rectal surgery cases, but occasionally I would do emergency general surgery cases when I was on call for the emergency room. And I realized that as much as I love the colon and rectal cases, especially the challenging ones, I did miss doing some of the general surgery procedures, the routine general surgery procedures that are often done, things like removal of the gallbladder or hernia procedures or appendectomies, things like that are fairly common. I missed doing them, so this opportunity here would allow me to perform those types of general surgeries. But my added value, hopefully, will be in providing more advanced care for people with advanced colon rectal problems, cancers of the colon, and problems with other parts of the GI tract. And even more commonly, and as according to Google, if you believe them, a few years ago, the #1 search for health topic on the internet were hemorrhoids. And so, we do a lot of those types of procedures as well. Not the most glamorous types of surgeries, but it's important surgeries and procedures that help a lot of people that are suffering from these problems.
So, as doctors in the medical profession, Lehigh Valley is noted for this. It's always prevention, 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 health education, health education. I mean, that's tons of information they give out. Colonoscopies, okay? When should you start going for a yearly, or excuse me, not yearly, but at least a colonoscopy exam?
Well, for someone who's asymptomatic and has no problems with the GI tract, no bleeding or abdominal discomfort or changes in your bowel habits, then the recommended screening age is 50. Now that can be different. If you have a strong family history, let's say your parent developed colon cancer when they were young, maybe in their 50s or something like that, then generally it would be recommended to start screening about 10 years sooner than the age that your first-degree relative got diagnosed. But for the average person on the street, 50 who's asymptomatic, 50 is the recommended screening age. There's some suggestion that in certain subgroups, subpopulations, particularly like Alaskan Eskimo or African Americans, you could possibly start at age 45 since they tend to develop cancers a little bit sooner.
And the advances today, I mean, God forbid someone has, colon cancer, there's different stages, of course, but the advances in technologies that are out there today, first of all, you want to get a colonoscopy that prevents these things, but if in case you do have something, I think you've seen with the technology and the surgeries, etc., and then whatever follows from that, you have a pretty good success rate. Am I correct in saying that?
Well, it depends. I mean, sometimes if we're fortunate to catch a colon cancer relatively early, then yes, hopefully we can catch it before a polyp in the colon turns into cancer. But for early stage cancers where maybe just the wall of the colon is involved, or maybe just a few lymph nodes adjacent to the colon are involved, then yeah, we can surgically remove the tumor and perhaps administer a cocktail of chemotherapy afterwards. Wow. And generally the people— I like
that word, cocktail of chemotherapy.
Generally the people do well. Occasionally we don't catch tumors in time and the tumors have metastasized to other parts of the body. The outcomes are not generally as good, but there are still options. Before, if someone had metastases to the liver, just a handful of them, we wouldn't really have much to offer them. But now, especially in the Lehigh Valley network down in Allentown, there's surgical options, intravascular chemotherapy options, radiofrequency ablation, things like that that are not overly invasive and can lead to prolonged survival in people with colon cancer that has even metastasized to the liver.
And so you were talking about, bringing, your relative, a young surgeon. That doesn't mean that you're not experienced in what you do. What do you think, you would be bringing to the table, in either latest surgical advancements or something that we should be, know about,
Well, I again do the full gamut of abdominal general surgery and most colorectal surgery procedures. What has been important over the last 5 to 10 years or so in colorectal surgery in particular has been a move to offer robotic procedures. And these are, where a robot is being hooked up to the patient and the surgeon is sitting in the corner of the room somewhere on a console looking through a viewfinder on the console at a 3-dimensional image of what the robot camera is seeing in the body. And the robotic instruments have very skillfully adapted to the surgeon's hands so that we can use a variety of movements with our hands at the console and transmit that to the robot who's actually performing the procedure. And let's say a surgeon has multiple cups of coffee in the morning and has a tremor in their hands. The robot eliminates that tremor, and it gives you
surgery today, yes. But everything's fine.
And in particular for colorectal surgeries, where we do a lot of operating in in the pelvis, which is a very challenging part of the body because it's very confined by a lot of the bones, and there's a lot of high real estate in that area with blood vessels and ureters and things like that. The robot really provides a very impressive advantage to be able to perform operations there where before you would have to make very large incisions on people. So it expedites their recovery, improves their physiologic stress, and maybe diminishes the amount of pain medication that they have to take after surgery. So it's been a real advance. So that, the hospital here has purchased a robot and will be in the process of setting it up and training the team to utilize it. My hope would be over the next 3 to 6 months.
What is, have you performed robotic surgeries?
Yes.
Yeah.
Yes.
And you,
it's if you like video games, it's almost like playing a video game.
That's amazing.
It's really improved our ability to get access to parts of the body that previously were not accessible easily unless you were to have to make a very large incision.
Wow.
And then it makes, if you get a chance, you can go on YouTube, you can witness some of these procedures. They're very elegant and nice procedures when you use that.
Are they more effective than if you were doing the surgery yourself?
Well, you are controlling the robot. The robot is kind of an adjunct to the surgeon, but like I said, it can provide improvements to deficiencies that the surgeon might have. For instance, a tremor or the inability to visualize a part of the anatomy appropriately. You can now turn the lights off on the robot, and you can highlight through a process of fluorescence where the blood vessels are. So it enhances your ability to do surgery and improves the capabilities of the surgeon.
That's incredible. Talking to Dr. Josh Nochumson, folks, surgeon here in Lehigh Valley Hospital Network. Certainly young, but brings a lot of experience in his field to the table. We'll be back right after this. Thanks for staying with us, folks. You're watching the Sam Lesante Show. We're talking to Dr. Josh Nochumson, surgeon here at Lehigh Valley Hospital. He's with the Lehigh Valley Physician Group and the Health and Wellness Center. Contact them or get information 570-5014-LVH. You brought something up about hemorrhoids, okay? And unfortunately, a lot of people suffer from that, and they're a little nervous about that because you hear all these things about it. Well, what do you have to tell them?
Right. Well, hemorrhoids are probably, as a colorectal surgeon, one of the most common reasons that people come to my office. And it takes a lot to get to a surgeon's office for this problems. People don't generally like to talk about these problems or go to the doctor for these problems, but they're very widespread, especially living in this country. We tend to be very sedentary. Our diets tend to be suboptimal. So these are very common problems in our society, and I think they don't all, most of the time, don't require a procedure to fix. Sometimes it's just a matter of modifying behavior or diet or things of that sort. But I get people in my practice, sometimes they won't go to the doctor for any problem, but they will come to the doctor if they develop, let's say, a thrombosed hemorrhoid, which is excruciatingly painful, or a fissure, which is a cut down by the bottom, which can really impact and affect someone's life. So if you can take care of those problems and fix them, in many cases, there's no more grateful patient. So, and to do it in a way that makes them feel at ease, because like I said, no one wants to come to the doctor.
I think that's the fact. You said it's sometimes embarrassment, or which is normal, but at least there's an opportunity for them to get better. It's like sometimes you don't like to dress certain things, but when you dress them, you know that thank God you have the doctor there to take care of them.
Some people will suffer for months or years, and then finally they can't take it anymore. They come to the doctor, and with a quick little surgical procedure, they within a few days sometimes feel dramatically better. So I get a lot of gifts and cards and things like that for those problems. It's not again the most glamorous thing to do, but it makes a big difference in people's lives. And so I think people shouldn't. There's a lot of people think, has this just happened to me? Am I the only one that has this? It's a very these are very common problems. It's a kind of a join the club sort of thing, and so I would encourage people to not feel overly bashful or shy if they're suffering from these issues to come to see a physician about it.
Well, you know, Dr. Nochumson, it's a pleasure to have you in our area. We welcome you to your area, and you're such a nice guy. You know, I mean,
you.
And I think, you know, first of all, as Lisa said before we did the show, you're probably looking at the biggest baby in the world right here. When I go to the doctor to get my eyes examined, my blood pressure goes up. I mean, but however, in the same token, you know, we have the health facilities here. You know, you go for your yearly physicals, etc. But to know to have doctors like you in our network, it's comforting, and I wish you the best. You know.
Well, thank you. It's an honor and privilege for me to be in this community, and I'll try to work as hard as I can to earn the respect and trust of this community.
All right. So now, what are the girls' names?
My oldest is named Sarah, and my youngest is Lilia, but we call her Lily.
Lily.
Yeah.
And does your wife work, or
My wife is a nurse. She's a cardiac critical care nurse, but she doesn't have her Pennsylvania license yet, and she may take a few years before getting back into
Good.
that.
Yeah.
Yes.
Well, let me tell you, housewives are like, they're like doctors.
That's right.
To be out. Well,
She has a harder job than I do.
Absolutely, absolutely. So the girls, are they like in the area?
They love it. We live in an area where there's a lot of young kids in the area,
that's good.
and so they're very happy to be where we are.
Right. Well, you're a family man. You know what's going on, and you have compassion. I always say that, you know, sometimes, you know, people are nervous to go to the doctor, and they don't want a person who doesn't have those bedside manners, and you certainly have them. And I wish you the very best, doctor.
Thank you. I appreciate it.
And tell Lisa not to have you a stranger on the Sam Lesante show. When the robotics come in, I know Lisa was saying we're going to be doing something special on that.
I look forward to doing that show.
Thank you very much. Dr. Josh Nochumson, folks. Now listen, any information you want, if you download our app, you can watch this show, particularly if you have hemorrhoids, folks. I mean, it's amazing. You know, get rid of the pain and anguish that you have. 570-501-4LBH is the number to call for information. Don't be afraid to do that, and we'll see you next time.